Hi, I'm Priya. I'm going to be performing the newborn bath. So before I begin, I just wanted to talk about a couple different patient teachings, just because it's easier to mention these specific things right now, and then I'll continue with the rest and do the other important information for the teaching in the actual procedure or demonstration, I should say. Anyways, so with patient teaching, you want to make sure you educate the mom and dad to do the bath on a flat surface, never leave baby unattended, and you want to make sure that you keep the baby warm. A couple other things is you want to make sure that you're timing the bath appropriately with the feeds. So what that means is it's best to feed the baby after the bath, just to prevent any spit up or vomiting. If they had a feed, make sure that you're doing the bath 45 minutes to an hour after for the same reason, so they don't spit up or vomit. One other thing is you want to make sure that the level of the water is below the umbilical cord. It's okay if the umbilical cord gets wet for a short period of time, but you don't want it to get wet for a long period of time, because that can cause a risk of infection. So with that being said, I'm just going to talk about some of the equipment. So you want 2 large towels for drying, 2 small towels for washing, some soap, your actual tub, new diapers, clothes, and blanket to put them in and swaddle, and then a comb. But with that said, you're only using the comb if the parents give consent. So you just want to ask if they're okay with it, gain their permission. The reason being is there might be cultural reasons that the parents might not want you to use the comb. So in that case, you're not going to use it, you're just going to surpass that step. But if they're okay with it, you can proceed to use it. So before starting, like I said, you want to check when the last feed was, but another pre-assessment check you want to do is the temperature. You want to make sure the baby's temperature is within normal range, 36.5 to 37.4. If it's below, you would want to schedule the bath for later. That's not a good time to proceed with it, because when you bathe the baby, it causes more heat loss. So if they're already not within normal range for temperature, you don't want to cause more heat loss. Yeah, so with the pre-assessment check done and you gain consent from the parents that they're okay with you bathing the baby, you want to make sure that you take your equipment inside and you check the temperature of your water. So you essentially you want the temperature of the water a little above lukewarm, but you don't want it too hot. So you're going to check with your wrist, you're going to check or with your elbow. If the temperature of the water is okay, what you can do is you're going to first start with the baby's head. So I'm going to lift the baby up. And just with plain water, no soap at this point, I'm gonna first start, I'm gonna wet my towel with water, wring it out. I'm gonna use a clean part of my towel and I'm gonna clean the eyes first, start with the eyes first. So inside to out, and then grabbing a new part of the towel that's clean, I'm gonna wipe inside to out on the other eye. The reason being, I don't want to spread any infection. If there's an infection in one eye, I don't want it to spread to the other. And then if you wanted to go back and re-wipe the eye to clean any gunk or anything, just making sure you're being mindful that each time you're grabbing a new clean part of the towel. So now I'm going to clean around the ears, never inside. You don't want to place any Q-tips or cotton swabs inside. So I'm just going to clean. And keep in mind, while I'm holding the baby, you see how I'm holding between the side of my body and with my arm under and my hand supporting the neck and the head. Now I'm just going to grab a new part of the towel, clean around the mouth, clean any colostrum off, just around the nose, not inside the nose, of course. And then like the cheeks, and then I'm going to just put this in there. I'm going to use the towel to just dry off their face. I'm going to put this down here. And now I'm going to wet the hair, and once I got it very soaked, I'm going to then use a little bit of soap. So I'm going to put some soap on this towel. So just a little bit of soap, and it's already wet. And I'm just going to let that lather up. And once I've got that lathered up, what I'm going to do is I'm going to use a comb, because these parents are okay with it. And you're just taking out any type of membranes or basically blood. And then put that down. And now what you're going to do is you're going to rinse it off. So you can use the towel to rinse, or if you want to use a little bit of water, that makes it easier too. And you're making sure you rinse it off properly. And then also you want to make sure that you're drying afterwards very thoroughly. And the reason being, I'll open this up actually. The reason being is the head loses a lot of heat. So you just want to make sure that you dry thoroughly. So now that I've done that, I'm just going to move this towel to the side. and I'm gonna unwrap the baby from the blanket, and we're gonna put them in the tub. The towel that, the small towel that I just used, I'm just gonna leave it on the inside the tub because it'll just provide extra cushioning for the baby's bum. So I'm gonna lift up the baby, and the way I'm gonna place them in here is that, so they're kind of laying in here, but my forearm is gonna support their head and neck, and my hand is gonna just hold onto their arm for extra support. So now using my second towel, small towel, I'm just gonna wring it in the water. There's already soap in the water, so it's fine, but you can use new soap if you want, it's fine. I'm going to just clean around their neck, getting in the folds, arms, and keep in mind, like I said, the water level is below the umbilical cord, and I'm gonna clean around the chest, and then we're gonna get into the folds, the groin, legs, and then what I'm gonna do is we're gonna rinse them off. Now what I'm gonna do is I'm just gonna lean them, like reposition them. So I'm gonna kind of make them sit in the tub, and I'm gonna hold onto their cheeks and lean them forward, and I'm gonna clean the back side. So never hold the neck, you would just wanna have them kind of lean forward, and you're kind of just holding onto their cheeks ever so lightly. You're gonna clean their back side, and then clean part, the bum, and then just gonna place this here, and we're gonna rinse. And I don't know if I mentioned this, but of course I'd be wearing gloves the whole time. And then once you do that, you're going to clean the genitals. So to do that, you're gonna bring them back, and you're gonna, again, forearm supporting the neck and the head, holding onto the arm. And if it's a female, you're just cleaning on the outside, you never go inside, so you're cleaning outside the labia majora. If it's a male, never retract the foreskin. So clean, and then we're gonna rinse, making sure that you're not trying to like wet the umbilical cord too much. So now that that's done and they're rinsed, I'm going to remove them from the bathtub. So I'm just gonna support the neck, and I'm gonna just place them on my new towel. Just gonna move that over there. So I'm gonna place them on this towel, and I'm gonna get my new towel here, and I'm gonna dry off their body. I'm making sure that I dry between the creases, dry around, and making sure I get in between the fingers because you don't want any moisture there in between. And same thing with the legs and the toes. And when you're cleaning, not cleaning, I mean drying around the umbilical cord, be very, very gentle, and never actually like pull or tug on the actual umbilical cord. You don't ever want to touch that, but you do want to clean just dry it around it. New part of the towel, of course. And then you can turn the baby over this, and you can just dry the back side, the bum. Make sure you dry it really well, back of the neck, and you fold your creases there. And now we're going to turn them over. So now that your baby's completely dry, at this point you're going to apply the new diaper. When you apply the new diaper, you're going to make sure that the diaper is below the umbilical cord. You never want to cover it. You want to make sure the umbilical cord can air dry, and that it's not going to cause any pulling, irritation to the actual umbilical cord where it can pull, and it's going to cause bleeding or infection like mentioned before. Once you put on the clothes, you can the diaper and the clothes, you can put them in the new blanket and just swaddle them. Of course, we're just going to pretend this is a new one. I know I used this previously, but I don't have all the resources at home. And you're going to swaddle them properly. Not that I can with the shirt, I apologize. And you can pass the baby over to the mother for skin to skin and breastfeed if they're okay with that. And reason being is that's a good time to bond. Baby is more alert for breastfeeding, and they can have a bonding time. And then just making sure you check the temperature 1 hour after the bath, and making sure you check the signs and symptoms of signs and symptoms of infection around the umbilical cord.